Hi, today we will be talking about changes to the ACA. This presentation is done by Dorcas Lewis and myself, Adam. Hi, my name is Adam W.E. Simmons. The ACA was brought into law in a response to a decades plus fight to get everyday citizens in America to the ability to be able to pay for healthcare. Healthcare, as we all know, is an expensive thing, and many people simply cannot afford to pay high amounts for healthcare insurance premiums every month. The ACA brought in the idea that the government can pay a certain amount of individuals' premiums. The ACA also gave us an expansion on Medicaid. There were other impacts and um, parts of ACA, many of which are still in place today. There have, of course, been many changes to the ACA. I say many that amount of times because it's been a lot. The ACA had a number of different parts of it declared unconstitutional, and the Congress adjusted it themselves. The ACA is a wide law, and today we're going to touch on just about every aspect of it. This presentation is going to give us pretty good details on the ACA, changes, laws, impacts, people's views, and so on. Those that became newly covered under the ACA fall into two different categories: the expansion of Medicaid and the premium help. That is, people receive government subsidies to help pay for monthly and healthcare insurance premiums. The way that we paid for this was actually having those that make over a certain amount pay more, and having those that paid under pay pay less. Um, this to a point required us to have an insurance mandate. It was one of the many reasons the insurance mandate was in place. The insurance mandate required everybody to get insurance or pay a fee at the end of the deal. This mandate at first was declared legal and then overturned by Congress. This insurance mandate, as it stands right now, has not had a massive impact to prevent the ACA from paying for itself. That, of course, can change. The insurance mandate was removed by Congress.
Hello, my name is Luis Arroyo, and I'll be speaking on exchanges and state approaches. Healthcare exchanges are organizations or marketplaces where consumers could purchase insurance premiums, and insurers compete for such customers by offering different plans for different needs and costs. Now, they fall into two categories: those for individuals to purchase premiums, or what is known as AHBE, is the American Health Benefit Exchange, and for small businesses to cover their employees, also known as SHOP, which is the Small Business Health Option Program. Now, states have the ability to set up their own healthcare exchanges, and some do so. Now, the rest of the states that do not set up the state-based market utilize the federal healthcare exchange market. Now, these exchanges enhance the market competition for healthcare insurance. One exemplary change that impacted insurance purchases on such exchanges was the discontinuation of cost sharing. The reduction, which helped reduce co-insurance co-payments and deductibles through tax credits to people that have incomes proportionate to their percentage of the national poverty line. When states institute the initiatives through exchanges, they attract more insurers to participate in these exchanges. Now, with the Medicaid program and the Affordable Care Act, the Medicaid program expanded under the Affordable Care Act, which included a broader set of low-income earners. The Affordable Care Act criteria for Medicaid eligibility were based on one's income relative to the federal poverty line. As such, the American Accountability Act allowed for Medicaid expansion to capture anyone who earned up to 133%. And children from households with the same incomes would be eligible under changeability till 2019. Now, the Medicaid under the Affordable Care Act initiative helped reduce the cost of health care for poor individuals or poor families. Now, in continuing the effects on health insurance premiums, the health insurance, since the introduction of the Affordable Care Act, has been affected by now, or I should say by how it was sold, and with the aim of subsidizing coverage for over millions of new people who purchase them. Even though the Affordable Care Act was intended to reduce percentages for insurance premiums, devoted to administrative expenses and profit, as well as requires regulators to determine the basis for increasing rates. Financial News lately reported that these rates of premiums have increased more than what was expected in the individual market. Now, the newly covered faced increases in premiums after the discontinuation of cost sharing reduction. By discontinuing such reduction, insurance also increased premiums for the Affordable Care Act policies and the silver level plans. Now, in other effects on the newly covered occurred through the termination of the individual mandate, which resulted in a premium increment of at least 3% for the bronze plan. Now, furthermore, removing the individual mandate meant that people did not wish to participate in health care insurance, were more likely to drop their subscriptions. This created a situation for those individuals.
Hi, my name is Dorcas Bully, and I'll be talking about the politics and policy challenges of the Affordable Care Act. The introduction of the Affordable Care Act has accumulated many debates since 2010 after it was implemented. The variables in play in the political debate regarding ACA's impact on cost include cost flexibility, that is, ways to improve competition so that consumers have the broadest choices of medical care services, and the issue of expanding options for patients to cheaply acquire prescription drugs. The other variable in political debates regarding health care access concerns whether to increase patients' ability to retain or select their preferred doctor. Some patients prefer to retain a doctor when they enter various plans in the market rather than being forced to accept a provider that the plan provides. The other variable in the political debate regarding the quality of care is the extent of coverage for pre-existing conditions, whereby insurers are either mandated to cover pre-existing conditions diagnosed when a patient is diagnosed at a facility. The current challenges for state and national policy makers include reducing prescription drugs prices, which are by far in the United States than in neighboring regions like Canada and Mexico. The other challenge is on the state versus federal interest in regulating drug importation. Example, Florida has approved a plan for importing cheaper drugs from Canada, but has waited for federal approval for over 3 years. Incentivizing participation by beneficiaries is the final challenge because such incentivization includes complex issues as consumer behaviors, employment status, and personal views. Now, is the ACA a good or a bad law? Several arguments have been made about the ACA, including cost, people should not be forced to be insured, and so many court decisions. But the bottom line is let's take a step back to consider the basis for which ACA was introduced. It was introduced to ensure that there is coverage for most low income earners and also prevent most circumstantial exclusion by insurance. It also helps lower prescription drug prices and could be amended to help states import drugs cheaply. So overall, it is a good law. In conclusion, multiple changes have occurred to the ACA since the 2016 presidential election, including the elimination of the individual mandate, removal of cost-sharing subsidies, changes in enrollment period, and work requirement eligibility for Medicaid. Such changes impact enrollment, example, fewer incentive for people to enroll. They also impacted premiums, example, the cost-sharing subsidy removal induced higher premiums. Some of the newly covered people faced higher premiums or dropped out. The other important aspect of the ACA is the health changes that improve competition in the healthcare market by offering diverse options for consumers based on needs and cost. The other ACA aspect is Medicaid under ACA, which covers more low income earners, and the changes that have affected it concerning working requirements for eligibility. Most of the most impactful changes have affected premiums through market effects that cause insurers to charge consumers more. The political debate concerning the ACA increasingly focus on premium cost, drug pricing, and the ability to get better care via a preferred provider. Overall, the ACA is a good law, but it can be improved to address prescription drug prices. The overall goal is to ensure quality healthcare services to more Americans. Hence, with the shift to a value-based healthcare, there should also be a focus on ensuring that cost is decreased to make it affordable to all. This is Group 6 presentation on the affordable healthcare. See you again. Thank you.
The ACA, being the best law that it is a law that has a lot of information online. With that knowledge, we have decided to add in a large amount of references, and we encourage you to review them and educate yourself on the ACA.